By partnering with healthcare providers across the capital, we've been able to ensure people in London who are experiencing a mental health crisis get the support that they need.
Emergency calls linked to mental health now account for around 10% of all the 999 calls we receive. 4 years ago, we were the first ambulance service to launch mental health joint response cars, joining together a paramedic and mental health nurse. So it allows us to do a full evaluation of the patient's mental and physical health. So they get the best possible care. I think one of the benefits of the mental health car is that we assess the patient in their own home. They receive a full medical state examination and we can then signpost them to the most appropriate care. And there's things like community mental health teams, there's a crisis team, there's things like drug and alcohol services should that be needed.
We try to encourage interventions in the community first.
It's better for the patient in the long term that we can come out and get them the care that they need when they need it.
Prior to the trial starting, not a lot of paramedics knew about the different services within mental health, so it's also good in terms of spreading the knowledge about mental health services for both paramedics and service users. We still work very closely with the mental health trusts. We're in communication. Even if a service user doesn't need a referral, we would get in touch with the mental health teams and let them know we've attended. This is the update. So should in future LAS or another service is called, they can see, okay, London Ambulance Service have attended on this day. Now we can see a pattern of why they may be getting better or they may be getting unwell. So it's quite good that we're constantly communicating and sharing our visits or our assessments with the other mental health teams. That also happens following jobs. If we see a service user and they are under a mental health team, we would get in touch with the mental health team and say, you know, we've seen the service user, they need a bit more support. Are you okay to arrange an appointment with them? Doing the car definitely has improved our relationship with mental health trusts, and not just Barnet Enfield Haringey, but also other neighbouring trusts that we have attended to. So it does have a positive effect in working in collaboration with other trusts and sort of giving them an exposure of what we do.
So this collaboration between the paramedics and the mental health practitioners enables us to utilise the services across the community which are available in the best way. There are monthly meetings between London Ambulance Service and the two trusts, North East London and East London Trust, where we will look at data, look at how the collaborative working is working, what's working well, if there's any learning from that, so that we can offer the best service we can to the local community. This partnership working helps to enable the person to get the right support at the right time in the right place. It's using resources effectively and get that message out there, what there is in the community for people, and this is one way of doing that.